President Biden announced a new goal of administering 200 million coronavirus vaccine doses by the end of April. That's double his initial goal of 100 million shots, which the U.S. met last week. So far, more than 133 million doses have been administered, and more than 47 million people are now fully vaccinated. Meanwhile, the U.S. has topped 30 million coronavirus cases. The death toll now stands at more than 545,000. And infections are beginning to increase again. Mola Lenghi is in Michigan, the latest coronavirus hotspot.
Tonight, an alarming increase. COVID cases spiking across the country in 20 states. 6 of them where cases are rising at least 20%. One hotspot, Michigan, with one of the highest number of cases per capita in the U.S., more than 5,000 just today, the biggest daily total this year. And hospitalizations there are spiking, more than doubling in the last 3 weeks, a 633% rise in people ages 30 to 39 since the beginning of the month, and an 800% increase among those 40 to 49 years old. Health officials saying the spike is likely due to the UK variant.
This is a race between the virus and the vaccine.
Dr. Nick Gilpin is the chief infectious disease doctor at Beaumont Health in the hard-hit Detroit suburbs.
The virus doesn't know boundaries, right?
Correct.
So is it just a matter of the variant having been introduced to these places?
That's exactly right. We believe that this variant, is going to eventually become the dominant strain.
His hospital system is now restricting visitors for the first time since last April. This as the race to vaccinate speeds ahead. Pfizer announcing today it's testing the vaccine in children 5 to 11 years old.
Hold on.
Dr. Emmanuel Walter is leading the Duke University hospital trial.
They're smaller, they have different physiology, they have different immune responses. So we really do need to assess and make sure that the vaccine is safe.
9-year-old twins, Marisol and Alejandra Gerardo, are 2 of the participants.
Hold on.
We spoke to them at home with their father, Dr. Charles Gerardo.
It's surprising and it feels weird, kind of, that you're in a history book or something.
They're going to play a role in the herd immunity of everyone else.
Very cool. Good job.
Ford Field here, home to the Detroit Lions, and the first mass vaccination site in the state opened up on Wednesday. 1 day later, they found themselves with an oversupply of vaccines. So officials opened up the doors to anyone 16 or older, and lines formed around the block of people showing up to get that shot. Beginning April 5th, anyone 16 or older here in Michigan will officially become eligible for the vaccine. Lana?
That's some great progress, Mola. Thank you. And Dr. Len Horovitz joins me now. He's a pulmonary specialist at Lenox Hill Hospital in New York City. Dr. Horovitz, thank you for joining us and thank you for all that you do. So let's get right to it. The U.S. has surpassed 30 million coronavirus cases, and the CDC says that the daily infection rate is now slowly increasing. At the same time, states are reopening. So please remind all of us, what do we know about asymptomatic contagion?
We have to keep in mind, as we hear these numbers, that the mitigation strategies that we dealt with last year at this time, namely masking, social distancing, hand washing, and avoiding crowds, are paramount in keeping the case numbers down as people start to eschew these rules. And we are in the 4th quarter of this, but it's not time to spike the football. We've got to be especially vigilant now if we're going to get to the finish line of this race of the virus against the vaccine.
Well, the U.S. is averaging about 2.5 million vaccine doses per day. You heard Mola say that they had so many there that they were able to open the doors to anybody who wanted the vaccine. President Biden is setting a new goal of 200 million shots by his 100th day in office, which is in about a month. We're on track, it seems, to hit this goal. But what does it mean for us to meet it, especially as we're looking over our shoulder at these variants that threaten our progress?
We have to keep in mind that the purpose of vaccination is to reach herd immunity, either through people who've got natural infection and some immunity that's temporary, or vaccination that would be more or less permanent immunity as far as we know. If we really need to reach 75% of the people vaccinated, that's 265 million people fully vaccinated. And here we have a situation, as you're showing, with 87 million people who've gotten 1 dose, and less than 50 million people who are fully vaccinated. So we've got a ways to go before we achieve a sort of magic number of 265 million people vaccinated.
Well, Pfizer has begun to test its COVID-19 vaccine on children under the age of 12. What can you tell us about this process?
I think this is an exciting area because, first of all, if children are vaccinated, of course, teachers are being vaccinated, schools can reopen that much more safely. And children are a vector of coronavirus, as anybody can be a vector of coronavirus. They can spread it asymptomatically. And so vaccinating children and cutting down on that spread would be very helpful, again, in contributing to herd immunity.
Well, Pfizer says that it hopes that it will be able to expand vaccination to kids by 2022. What does this mean for kids returning to school in 2021 in the fall? And as a follow-up to that, how important is it for children to be vaccinated? Is it important for children with certain underlying health conditions, or is it important for all children?
You certainly want to vaccinate children who have underlying conditions, autoimmune problems, malignancies, that sort of thing. But at best, it would be great to reach the entire population of children, since they are the ones who spread it between themselves, take it home to parents and grandparents. And so the mitigation strategy now of 3 feet apart may or may not be enough to prevent spread in the schools, and so vaccination would be paramount.
We've also been keeping our eye, Dr. Horowitz, on the global response to the pandemic. And Brazil became the second country Wednesday to top 300,000 coronavirus deaths. The health systems there are on the brink of collapse. How concerned are you about how this will impact both global and the U.S.'s pandemic recovery?
Brazil's situation is really dire and pretty devastating, and we have to keep in mind that we don't conquer a global pandemic until every country on the globe is vaccinated or safe from infection. And so the vaccination rate in Brazil is appallingly low. And if we can achieve a higher vaccination rate and herd immunity in Brazil, which is going to be difficult, that's just one country. We still have other countries like Papua New Guinea, which had no cases for months and now is overrun. So we have to vaccinate the entire world.
All right, Dr. Len Horowitz, thank you.
Thank you.